What are functional medicine doctors? My name is Dr. Erica Steele. I'm a board certified naturopathic doctor. I hold 6 degrees in my field, all in the natural healthcare space. I also hold hundreds of certifications, and you guessed it, one of them is in functional medicine. One of them is also in integrative medicine. So I have a deep love for laboratory diagnostics and biochemistry. All right, so what is a functional medicine doctor? So functional medicine doctors can be pretty much any type of doctor. So they can be a medical doctor or a chiropractor, or I've even seen acupuncturists as functional medicine doctors. And so I've seen a lot of those types of providers. As a naturopath in my naturopathy training, I did 2 year, the last 2 years, all in functional medicine, laboratory diagnostics. I really loved labs from my childhood, growing up, running around labs with my parents. And so I really wanted to specialize and really focus on laboratory diagnostics. So when I found functional medicine, it was like, click, right? So I often get asked, I'll do TikTok lives or I'll do seminars or educations or any sort of thing like that. By the way, if you want to learn more from me, I have tons and tons of courses below. And so go ahead and click the link. Tons of classes from nutrition to detoxification to mental health, emotional health. So if you're interested in that, please check that out. When I go on and I educate people about these various topics, oftentimes people are like, oh, what do I take for this? And what do I take for that? And what do I take for this? Right. And so we test, we don't guess. And so the reason being is because people often come to us because they don't want a reactive healthcare approach. They don't want to just be given a pill, right? So the irony here. So they don't want to go to the medical doctor, right, and get a pill for care. But then they come to us in the natural world looking for a pill for care, right? Like, make it make sense. So it's not just about taking pills. It's not just about taking supplements. It's about really understanding the function of the organs. Hence, in functional medicine, the first word is functional. It's about improving function of the organ system. So how do we improve function of the organ system, right? So it's usually habits and behavior, because it's not a quick thing. You either, in any given moment, you're either building health or building disease. And so how do we build health and build disease? First things first, we have to make a decision, an intention, and then a mindset, right? We have to believe, right, that we're worthy of getting well, that we desire getting well, that we are capable of getting well, that that it can be fun, it can be easy, it can fit into our lives. We have plenty of time for it, right? There's a lot of limiting beliefs that people have around their health. And then we have to be emotionally motivated, right? We have to feel like this is something that feels good. Otherwise, there's not going to be a motivation. You're going to try to power your way through it. And what will happen is after 3 or 4 weeks, you'll crash and burn and won't continue. And that's just the way the human is constructed with motivation and behavior, right? And then mindset, emotion, and then action are consistent action every single day. So mindset, emotional health, and then your actions, which lead to then habits, behaviors, and then eventually lifestyle. So how do we improve the function is through the habits and behaviors in your lifestyle. And so that's not just about taking a pill. That is also about working on your mindset, working on your emotional health, clearing any limiting beliefs, clearing any blockages that may be in place, clearing trauma responses that are emotionally holding you back. And so that it makes it easy to perform the actions like drinking water, which improves function. We want to make sure we drink half our body weight in ounces in water, making sure you're eating enough protein. Protein allows the body to repair and heal, keeping your body moving. And so you keep strong and your ligaments and your tendons are, loose and agile. So these are the actions that are going to improve function. Notice I have not brought up a supplement yet, right? And so true functional, medical doctors. So there are medical doctors that get into functional medicine, and so we are not. I'm not a medical doctor. I'm a naturopath, and so I believe that we're kind of the originals because we understood, just like Bechamp did, who was a biologist who studied the function of the organs and who believed that if we improved the body's internal health and internal state, what would happen is that the body could, prevent disease. It didn't have to necessarily be afraid of, the germs out here in the world, because the immune system was supported and healthy and whole. Now, there are breakdowns that people have in the immune system that leave them more susceptible. And so we want to work on building the immune system. Majority of the immune system's housed in the digestive tract. How do we heal the digestive tract? Through what you're eating, what you're breaking down in your stomach, what you're metabolizing in your liver, what you're assimilating in your small intestines, what you're eliminating in your large intestines. So that is the breakdown, right, of building all of that wonderful gut microbiology and that gut flora, which helps to contribute to a supportive immune system. The liver, I cannot even stress enough, is so important in making sure that the liver is functioning and working well. So we are looking to improve function. And so lifestyle changes are going to trump any kind of supplementation. Now, once we have done that, right, now we can start to, and it doesn't have to be perfect, 80% kind of healthy lifestyle. Then we can build upon that using supplementation. So patients will come to me. I'll do a functional lab on them. Well, actually, I take that back. I'll do a basic lab. Like, we're talking what a primary doctor would run, like your CMP14, CBC with diff, TSH lipid panel. And then I've added B6, B12, folate, magnesium, and homocysteine since COVID and everything, to make sure that we're not driving inflammatory processes and the cardiovascular system is healthy. So we look at that basic panel, but it's in how we interpret it. So we interpret the labs differently, right, than your standard medical doctor would. So your standard medical doctor is going to interpret labs in a standard diagnose and manage model. That's how they're trained. They're looking for a disease process to then diagnose the disease and then manage it using a pharmaceutical, a procedure, or surgical intervention if one is available. When we're looking at function, we're looking at how those organs are functioning. We're looking at how the kidneys are functioning. Are they filtering properly? How the liver is functioning. Is it filtering properly? Is it metabolizing properly? How is the immune system functioning? Are there things that are weighing it down or inhibiting it, or sending it into an autoimmune state? How are the fats processing in the system? Are you driving cardiovascular risk? So we're looking at how the organs are actually functioning, right? And then we want to improve function. So how do we improve function, right? We work on mindset, emotional health. Then we look at what your habits are. So your habits are, you're skipping meals, you're not eating, you're not sleeping, you're stressing out. What are your, how's your diet, your physical exercise, how are your relationships? All of those habits all play into why you may not necessarily be achieving the health goals that you're looking to achieve. And so we break that down step by step, and it's definitely a long game. That's why I've developed all these courses, really to make it more accessible for people, because it's not always accessible to work with a doctor like me. Financially, it is an investment. There are many people that do work with doctors like me, and I would say that I try to make it much more affordable. I know there are some functional doctors who just really outprice themselves, and they do short courses, and for me, I do it because I love doing it. I do it because I love helping people transform, and I love, seeing that evolution in the patient. And I always say I'm in the people business. So, if you get results from the work that we've done, you're going to go and tell 10 of your friends. That's just how it works. Rather than if I'm, charging $1 billion for one person, and then I'm only working with, the top 5% or whatever, which there's nothing wrong with that. And I do work with some of the top 5% people. However, I really wanted to impact, right, more people, right? So even if, let's say, that is not accessible, because sometimes it's just not. Sometimes, with health insurance and having to pay it, because I don't accept health insurance anymore, sometimes it's competing. And so I get that. So that's why I've developed these courses to really teach you step by step. Now, obviously, you're not going to have as much accountability as if you were working with me. However, you do get the education and you do get the conscious awareness, and we break it down step by step. What I've learned over the last 20 something years being in natural healthcare professionally, I've learned how to actually put these things in order. So I've learned, okay, this, we have to prioritize this first, and then this, and then that. That's again, okay, so that's how we got to mindset. That's how we got to emotional health and actions and habits and behaviors, was because of my clinical practice. Because I would come out strong with all these protocols and tell these patients to do this, that, and everything. And they couldn't do it. They failed again and again and again. And I watched them struggle. And so that's when it got me thinking, my scientific brain, why would that be? And I really started breaking things down. So what I've learned over treating thousands and thousands of patients, I think it was like 40,000 plus patients since 2009, I have learned kind of, how most humans, I know everybody's a special snowflake, but most humans, how they work. And so I've put those in course format. So if you want to learn how to drink water, I know that sounds so, trite, you just drink it, right? But there is a process to it, especially if you're not a natural water drinker. And so like me, I'm not a natural water drinker. I have to really be conscious of it. So I developed a course for that. I developed a course for, your nutrition, how to break this down, how to eat, not a diet, but like really understanding and learning nutrition so that you can learn how to feed yourself. If you struggle with your emotional health, I did a course on, 30 days to emotional healing. That's a course specifically to learn emotional coping skills. Because if you're anything like me, I didn't learn those. The coping skills was shut it down and keep performing. Those were the coping skills, which of course didn't necessarily work. But product of two Marines, that's what you get. Adapt and overcome, simplify, hoorah. So I love my ferrets. So the thing is that I really developed these courses so that people could learn and it could be accessible. You get it in an app format. You're able to track your food in there. You're able to track your water in there. You're actually given tasks in a course. So you just check it off. So you get that little dopamine hit when you check things off. But you also get messaging. So if you ever have a question, it's not like you're in a silo. You can ask a question. We do have some groups in there as well that you can be a part of, and you can communicate with other people that are in your program. So there's that community element. And then let's say you get stuck and you're like, you know what, I do need to talk to the doc. We do have virtual clinic hours that you can pop in and, ask a personal question. So it's a really good resource. It's super valuable. I really encourage you to check out some of the courses just to really learn. So you're not just taking a whole bunch of supplements. People take way too many supplements, and that's not really what it's about. So I just wanted to educate you about what a functional medicine doctor is, what we do. We have specialized training in clinical biochemistry and laboratory diagnostics. So we read labs definitely more in depth than your standard allopathic medical provider, because they're just looking to diagnose and manage. Nothing wrong with that. That's just their scope of practice. So we really are looking at the function and how the organs function. And then we create protocols based off of improving function, because we believe the body was made to heal itself. If it's given the right environment, our job is to create the environment that's conducive for healing, which is definitely a naturopathic philosophy. And so we want to teach you how to do that so that you can be well and disease free. So if you've liked this content, please like, share, comment below, and I'll see you in the next video.